we have this final subject, which is the 19th subject of our game changing session, which is the anesthesia part, and after that we'll be done with it. Fine. And don't worry about the GT. Okay, just try to give GT. Why I am telling is that because now you know what is the content. Okay, till now you got an understanding that content what they will ask, but you don't know how to solve the questions. So then what you will do? You started solving PVQs and you started solving this QBank or custom modules. Then you know idea. Okay, then the set of mind or the mindset means 19 subjects will be floated like this. Okay, it will be floated like this. So you should think in all subject perspective, and everything should come in mind, and there will be this clock will be ticking. Okay, 50 minutes, one set, 50 questions. So 3 sets, 1 hour means like 150 minutes, 50 minutes each set. So you should be always vigilant about it. Okay, because once you complete this 300 minutes, okay, 300 minutes you should be having the satisfaction. Okay, then if you have the satisfaction, that then only you can have a like peaceful life till your result. Okay, so try to have the satisfaction and try to have this imagination before your examination. So if you do grant test once or twice, then you will able to see like, yeah, this is how gonna happen, this is how gonna attempt, this is how I'm making mistakes, this is how I can improve. Okay, and in this subject is my weak subject. So try to attempt few grant tests, and initially your score will be in a lagging phase, and sometimes it will come into a stationary phase. And if there is stationary phase, analyze yourself which subjects you are weak at. You are weak in this subject, make sure you are revising it and you are reading the PVQ for sure before going next step. Fine. That is the mind kind of things, and with this we'll move on to the final part of our game changing session, that is the anesthesia part. Right? And in anesthesia, if you see, we'll use this oral cavity assessment. Okay, what is for this? For example, a patient came, or you are going to do an elective surgery. Then you need to know, means during elective surgery or when you are giving this general anesthesia, you need to make this patient to be respiring. Okay, so what you will do, you will put this ET tube. So to put this ET tube, you need to know whether this oral cavity is adequate so that you can perform this maneuver and put the ET tube. So in such scenarios and things, we will use this score. This is known as Mallampati score. Okay, and I don't know why they have this love towards this Mallampati score. Mostly they will ask at least one question from this Mallampati score. Fine. And in Mallampati class 1, if you see, the tip of the uvula will be visible. If the tip is visible, it is class 1. So tip will be visible, rest of the uvula will be visible, soft palate also will be visible, hard palate also will be visible, and along with this tonsillar pillars. So tip and tonsillar pillars are visible in a case of class 1 of Mallampati scoring. Whereas in a case of class 2, tip and tonsillar pillars won't be visible. There will be no tip, no tonsillar pillars, which will be seen in a case of class 2, Whereas in a case of class 3, there will be no uvula itself visible. It will be only soft palate and hard palate will be visible. This soft palate and hard palate will be visible in a case of class 3. Whereas in a case of class 4, only hard palate will be visible. Okay, only hard palate will be visible. Okay, and next this stage where when you tell the patient to open the mouth, look, it is beautiful view. If you see here you will be able to see the epiglottis even. So if you see this type of airway, आपका ET tube आराम से चले जाएगा. Okay, you can even close your eyes and you can put the ET tube. Okay, so this is this grade 0. This is the class 0 kind of Mallampati classification. This is the class 0 of Mallampati classification. See, and next we have one more grading, which is known as ASA grading. ASA grading, it is done for this based on this complications what can be having. For example, in the case of ASA grade 1, it is a normal healthy patients. Okay, normal patient फिर क्यों आए हैं, ठीक है ना? Then means for example normal patients is done for the small lipoma or something small. So he's a healthy non-smoking or minimal alcohol use. So it is a ASA grade 1 patients. In the case of ASA grade 2 patient, this is a patient with mild systemic disease. Okay, mild systemic disease without any limitation. Yeah, without any limitations. Fine. Or well controlled, or systemic disease which is well controlled. Fine. Whereas in grade 3, it is what? It is having this severe systemic disease, which is not controlled, means not under controlled diabetes or not under controlled hypertension. This is not on control. Okay, whereas in grade 4, he is having a disease which is what? Which is having this constant threat to his life. Because of this, there is high BP. It is not just high BP, it is very high BP. It can, anytime it can turn into a cerebrovascular accident. So it is what it is, this grade 4 patient who is presenting with this systemic disease along with this constant threat to his life. 5. Whereas grade 5, it is this moribund patient. Okay, moribund patients, and if you didn't do anything, the patient will go and die. So this is the ASA grade 5. Whereas grade 6, it is what, the patient who is already declared blinded. So blinded patients for organ harvesting will classify them as ASA grade 6. So ASA grade 1 normal, ASA grade 2 there is systemic illness but well under controlled, grade 3 systemic illness which is not controlled, whereas grade 4 with the other systemic disease which is having this constant threat to his life. Grade 5 it will be what? It will be this moribund patients. If we didn't do anything, the patient will die for sure. Grade 6 it is what it is, this blinded patients. Okay, blinded patients. So these are the things you should know. Yeah, good guy. About this ASA classification, one of them either of them they will ask it. Fine. Next, about this instruments, you need to identify. Okay, this ET tube, it was asked in 2022 December. Okay, this is asked in NEET PG 2024. Okay, see, if you see about this ET tube, it is what? It is endotracheal tube. It will be having this 2 openings. Okay, 2 opening. ये दूसरे के नाम है Murphy's eye. The another name of this opening, which is known as what? It is known as Murphy's eye. Okay, so during any procedure, if this secretion got obstructing the main duct, you should go and suction it, right? So for this, we'll use this Murphy's eye, or for this preventing from this blockage also we'll use this Murphy's eye. Fine. And they will ask you which of the following will determine the resistance of this tube. Which of the following will determine the resistance of this tube? The length or the diameter? Remember, that is what? It is the diameter of the tube. Diameter of this tube which decides its resistance. The diameter of the tube which decides its resistance. Fine. And now you need to do some oral surgeries. You know, this tracheal tube you need to put within your mouth. Okay, whereas you need to do some ranula excision or some other surgeries. Then you will use one more tube where you will put your tube by this nasal route, which is known as what? Nasopharyngeal airway. This is known as what? Nasopharyngeal airway. Fine. And next, there is a patient who is presenting with this pulmonary hematoma. There is a patient with lung cancer. In the case of those patients, you want to remove some portion of the lung. So in such cases, what you will do, you will use this tube which is known as double lumen tube. In these cases, one lumen, it will go and ventilate the opposite side lung, and one lumen you can obstruct and you can do procedure. Okay, so this will go and ventilate one side of the lung. That is the double lumen tube. Fine. Then this is the laryngeal mask airway. So for any simple procedures, you can use this, which is known as laryngeal mask airway. You don't need any laryngoscope, you just put it in, it will go and sit, you will just inflate it and you will do anesthesia. That's it. Then LMA Procil, but the problem is that this will go and sit over the epiglottis and it can cause aspiration. If this causes aspiration, then it can cause aspiration into the respiratory tract. So to prevent this, we will have this Procil LMA, which will be having this opening for this for this NG tube, yeah, NG tube, yeah, good Dr. Gautam. There will be 2 tubes. This is LMA, this is the NG tube. Fine. Next, we have one more tube where we can there will laryngeal mask airway will go and sit over there. But with this laryngeal mask airway only, we can do intubation. Here intubation will be so easy. So it is what it is known as intubating LMA. Here you can intubate, it is known as intubating LMA. And for example, if you are doing this surgery like this, means like you are doing it supine position, then it's fine. But you want to operate on this myelomeningocele, or you want to operate on this sebaceous shaft, which is on the downside. So at those moments, what you will do, you will put a tube. If you put this normal tube, then while coming it will bend. So to prevent bending of the tube, we will use this armor tube. Okay, we will use this armor tube. Remember, we will use this armor tube. Okay, fine. This 2 tubes, which is this ray tube, which is having this south facing and north facing tube, they are known as ray tube. Next, this is known as what? This is known as Goodell service. So see, during intubation you intubated, but there will be this tongue, right? When you give anesthesia, the tongue will try to fall back. So to prevent this tongue to fall back, okay, prevent fall back of tongue, will use this Goodell survey. And they will ask you, how will you measure? You will measure from tip of this mouth to angle of mandible, to the angle of mandible. So tip of the mouth to the angle of mandible, This is here, sorry. This is the tip of the mouth to this angle of mandible. You will measure this Goodell survey. Once you put, this tongue won't fall back. Fine. And next, if you are able to see, this tube, which is known as what? Tracheostomy tube. See, So you got a patient who is being intubated and kept in ICU for a prolonged period. So after some time, this laryngeal cartilages or this trachea, where you put up this in ET tube, it will go for this softening. So to prevent this, what we will do in the prolonged cases, we'll do this intubation. Okay, we'll do this tracheostomy. So initially we'll do with this PVC tracheostomy tube. We'll do with this PVC tracheostomy tube. Fine. And then we'll move on to this oxygen delivery devices. Fine. Now, means if you see, you saw a patient. Now, as I told you, in asthma patient likewise, you saw a patient who is presenting with this features of respiratory difficulty. You put up an oxygen saturation probe and you saw how much is this oxygen saturation. The saturation was like Manlo 89. Okay, so you started with what? You started with the first one, which is this nasal cannula. Also nasal cannula. This nasal cannula can deliver up to 0.4, okay, 0.4 of FiO2 or 45% of oxygen, and it can deliver up to 2 to 6 liter of oxygen per minute. Fine. Then you tried, you saw, you waited for a few minutes, then the oxygen probe you checked, it is still the same. It is still the same. So as this is still the same, then you plan to move on to the next part, which is this mask. Okay, it is not the simple face mask. It can deliver up to 60% of oxygen and it can deliver up to 6 to 8 liter of oxygen. Okay, when you try this, then you check it is improved, but it is not much. It is from 89, it became 90, but not more than that. So you try to use this next mask, which is known as what? A mask, non-rebreathable mask. The mask along with the reservoir bag. This is the reservoir bag. Because of this reservoir bag, it can deliver up to 90% or even 100% of the oxygen. And it can deliver up to 6 to 10 liter per minute because of the presence of just this one reservoir bag. Right? And next, you want to deliver just limited amount of oxygen. For example, मुझे इतना % oxygen patients को देना है. Okay, and if you have this only limited %, then you can use this type of mask, which is known as what? This is known as ventry mask. Yeah, good guys. Ventry mask, it can deliver up to 0.6%. And this is the anesthesia mask. Here, see, there is this compression so that there will be no dead space. There will be enough space between. There will be no space between this mask and your skin. So this will be, this air will be filled. Okay, this is what? This is the anesthesia mask. This can also deliver up to 100% oxygen. Yeah, good, fine. And next, during COVID, this devices has been used very frequently. See, this is known as HFNO system, high flow nasal oxygen. How this is the high flow nasal oxygen? See, in the case of high flow nasal oxygen, it also looks like this cannula, nasal cannula. But this is very high flow one. Okay, very high flow one, and it is inserted till here. Okay, there will be small knobs like this, and we'll keep it inside. So it will reduce us some part of the nasal dead space, and it will produce high amount of oxygen, and there will be always presence of humidifier. This will be having an individual humidifier, whereas this rest of them will just connect to the main line. Okay, if it is central line, or like before that, we'll be having a humidifier for sure, but we'll connect to that lines, whereas here it will be having its own humidifier. Fine, yeah, humidifier, it is high flow. Next, about this cannula. If you know about this mnemonic, it is well and good. If not, just learn this. We see, in the case of this cannula, if you see the central one, the red one, or this orange one kya? It is the lava. See, it is about our earth. So central one, it is what? It is lava. So lava will be in the central. Okay, then it will be surrounded by the soil, which will be grey color soil. Then above that, there will be our grass, like hare grass. So it is means like green grasses, like hare. Then there will be the stem, then followed by this flowers. The flowers are pink in color. So the pink flower. So lava, soil, then green grass, then stem, which is also green, then the flower, which is pink in color, and it is in a sky, which is what? Which is this blue sky, and above the sky there is a sun, and above the sun there is a galaxy. Okay, galaxy. Okay, galaxy. Okay, remember. So yeah, fine. If you know this, then you can just see, like, it is 14. From 14 you can start, and you can remembering in a sequential. So if not, just see the female, they always want to be in their 20s. Okay, and they like flowers. So all of them, like if female 20 gauge, and it is equal to this flower. What? It is this 20 gauge cannula, which is pink in color. So pink in color. So it is a pink color cannula. It is a pink color cannula. So if you are able to remember, then remember it is. If not, just remember, you will get green signal for everything. You will set green signal at 18 years. So remember, at 18 gauge it will be a green cannula. 18 gauge it will be a green cannula. So you can go down. Green, then brown will be there. Then there will be a lava will be there. Above if you go, there will be a pink flower will be there. Blue sky will be there. Then followed by there will be a yellow sun and there will be a violet galaxy. There will be a, just add one more thing. It is the violet galaxy. Which will be having the cannula size of 26. Yeah, 26 gauge, which we mostly use in a case of newborns. Newborns में हम 26 gauge use करेंगे. Okay, good guys. Fine. Next we'll move on to this complication of anesthesia. What are the complications of the spinal anesthesia? If you see about these complications of the spinal anesthesia, okay, usually when you give the spinal anesthesia, either what you can do, will put them in Trendelenburg position or reverse Trendelenburg position. Okay, so when you put up in a reverse Trendelenburg position, what will happen is that this anesthesia, it will go upstairs. Like either it can go upstairs or downstairs. So if it is go downstairs, there is no any issues. If it is go above the decide level, then what it can happen? What it can happen is that it go and suppress this cardiac system. Yeah, it can go and suppress this cardiac system. It is known as what? High spinal anesthesia. If it is go more further, it is known as total spinal anesthesia. It will happen at this moment. And there is the next condition. If you see, the most common complication of this spinal anesthesia, okay, it is the hypotension. It is the hypotension. So that's why in a case of, while giving spinal anesthesia, we'll give enormous amount of IV fluids. We'll give good number of IV fluids, we'll give them. Okay, and if it is still not dissolved, this hypotension not dissolved, then we'll give phenylephrine more than ephedrine. Phenylephrine will try to give. Fine. And next, after post surgery or post spinal anesthesia, what is the most common complication? It is what? It is this urinary retention. It is the post-op urinary retention. Fine. Next, if there is post-op shivering is there, then we'll give pethidine. And the next complication, which is this post-dural puncture headache. Previously, we were using this dura separating cutting needle. So because of that, there are more prevalence of this headache. Now we are using this dura separating needles. Because of this, there is no or less chances of this post-punctural or post-dural puncture headache. Fine. And it happen after 12 to 24 hours. Usually, we'll tell them to take this caffeine and NSAIDs. It will be resolved. Okay, it will be resolved. If it doesn't resolve, then we'll go for this epidural blood patch. Fine. Next, about this anesthetics agents like inhalational, IV and muscular agents. Fine. If you know about this inhalational, see about this halothane, isoflurane, sevoflurane and desflurane. See, sevoflurane, it is the sweet fluorine. Sweet. So because of the sweet, the children's love more. So it is the induction agents for children. Okay, it is okay, fine. And in halothane, it is lal. It is the lal hai. Okay. So halothane, it is stored in a lal. It is stored in a red color container. Okay, and it requires special containers as well. Okay, it requires special containers known as Tech6 containers to store. Okay. So halothane, it is one of the good one. लेकिन उसको container का storage वजह से we won't use it much often. Okay, remember, fine. But halothane will be associated with this some other conditions. For example, it will sensitize this myocardium. Okay, it will sensitize this myocardium. So it will be avoided in a case of catecholamine producing tumors, like in a case of pheochromocytomas. Okay, pheochromocytomas. And it is contraindicated in the case of neurosurgery, and it can be used in a case of asthma patients because it can produce the best bronchodilation. And this H for halothane causes hepatitis. So halothane causes hepatitis, and it is not used in neurosurgery, and it can cause sensitizing this myocardium. So we cannot use in a case of catecholamine secreting tumors, and it can cause maximum muscle relaxation and maximum bronchodilation. Maximum muscle relaxation and maximum bronchodilation. इतना दोनों याद रखना. Then about this isoflurane, it is being widely used in most of the surgeries in a case of cardiac surgeries and in a case of neurosurgeries. Okay, it is second choice for this neurosurgery. Okay, but preferred one is desflurane. But desflurane also, I guess because of this reason, we won't use desflurane much often. We use isoflurane. Fine, but isoflurane, it is used for this most common for this cardiac surgeries. Remember, it is the most commonly used for this cardiac surgeries, this remember. Fine. Second choice. Then about the sevoflurane, it is most common used in a case of children's में use करते हैं, and it is used for this asthma patients because it won't cause bronchoconstriction. And desflurane, it is used in a case of Daycare surgeries. Okay, daycare surgeries, if it is not used, then isoflurane. Fine. If it is not used, it is isoflurane. Then desflurane, it is also most common for this. What? It is also most common for this heart surgeries or severe surgeries, but we won't use desflurane much often. We use isoflurane. So isoflurane is used in the case of both daycare surgery and in a case of heart patients. So heart patients and daycare and heart. If it is not used, then it is the desflurane. Okay, then it is the desflurane. Remember. Okay, fine. Yeah, then that will come under IV category. Fine. So if you see this, yeah, it is used in hypotensive anesthesia to control blood field during surgeries. Just you can add one more point, but will prefer less during this neurosurgical part in a case of isoflurane. Okay, just remember. Second, it is a second choice. Okay, second choice in a case of neurosurgery, which is isoflurane. Whereas first choice, it is desflurane, and daycare surgery also it is desflurane, and cardiac surgery also we can, if we have, then use, if, but we won't use desflurane because of non-availability. So daycare and cardiac surgery mostly will use isoflurane, whereas for neurosurgery we will mostly prefer to use desflurane. Okay, okay, just remember this 3 points. That will be more than enough. Next, about this sodium thiopentone. Sodium thiopentone, it is what? It is one of the best friend of CNS. So what we can do, we can use in a case of neurosurgery. But this neurosurgery, we used to use this sodium thiopentone previously. But now, if you see this one is being replaced by this ketamine. So ketamine we can use in a case of we can using as a successors. Fine. Whereas previously this sodium thiopentone we use for main neurosurgeries or in a case of any cardiac, means in a case of CNS trauma. Fine. And it will be available in amorphous powder. It will be available in amorphous powder. Itna yaad rakhna. Okay. Then this is contraindicated in the case of asthma, acute intermittent porphyria. This is contraindicated in the case of asthma, acute intermittent porphyria, and it can cause accidental injection, means this is intravenous anesthesia. So if there is any accidental injection of this drug into this intraarterial, then what will happen? This can cause painful, or this can cause vasoconstriction, and this can lead to this ischemia over the region. Okay, so we need to safely use this sodium thiopentone. Okay, and next we'll see about the propofol. This propofol, it is the milky white one. It is the milky white, and see this propofol, it is the drug of choice we'll use for this daycare surgery. And we know, and we know this propofol, it is a yellow, means milky white solution, and it will be having this egg allergies. Fine, egg allergy, it will be milky white solution. Fine, and propofol, remember, propofol falls BP, so it will decreases BP and decreases heart rate. So it is contraindicated in a case of shock. And it can be used in a case of acute intermittent porphyria and any daycare surgery, which is the drug of choice, and it can be used in a case of LMA insertion and malignant hyperthermia. So in all of these cases, this propofol can be used. So daycare surgery in a case of gaseous will mostly think of what? Desflurane, but it is less commonly used because of some reasons, because of non-availability. So we'll use isoflurane. Fine. Then propofol, it can be used in a case of AIP and LMA insertion daycare surgery, and it is having this antiemetic properties as well. And we can perform one more surgery, which is known as total IV intravenous anesthesia. Only with IV anesthesia we'll perform surgery. But whereas in usual surgeries, what we'll do, first we'll give induction agent, which is usually this gaseous agents, and followed by this we'll administer IV agents for the maintenance. Whereas with propofol, we can do a surgery which is known as IVRA, intravenous regional anesthesia, where we block this hand and we'll give this drug and we'll do the surgery there. So okay, that is there. Fine. And next, if you see about this ketamine, it is this, it increases ICP and it can cause dissociative anesthesia. So this ketamine, like, it is used in a case of asthma, okay, asthma, and in a case of shock. So remember, in a case of asthma and shock, we'll use ketamine. Whereas in a case of any head injury, we'll use propofol, head injury. Okay. So previously the neurosurgery we used sodium thiopentone, now it is being replaced by this propofol. So propofol, you need to remember 2 words. It is used for this daycare surgeries, IVRAs, and head injuries. So in the case of CNS also we'll use propofol. Whereas ketamine will be used for this shock and this smoking, means like in this bronchodilators, like in asthma patients, will use in a case of ketamine. So ketamine will use in a case of, it causes maximum dilation, so we use in a case of asthma patients, and shock, and along with this cyanotic heart disease also we can use this ketamine. Okay, ketamine. and it is contraindicated in case of epilepsy, glaucoma, schizophrenia, and ischemic heart disease. Okay, so but it is used in shock and asthma. Shock and asthma. Okay, just and ethomidate. Remember, ethomidate is used for this CVS. Okay, ketamine it is used for shock. Means that when there is decreased pulse and decreased BP. Whereas ethomidate, if it is in associated cardiac conditions, will use ethomidate. We will use ethomidate. Remember, we will use ethomidate. Whereas inhalationally, will prefer desflurane. If not, will use isoflurane. Fine. Remember, so it is used for this, mainly for this cardiac surgery. It is the most cardiostable. So in few lines I will write. If it is in a case of CNS surgeries, we'll use Propofol, more common than sodium thiopentone. Fine. If it is asthma and if it is shock, we'll use ketamine. Okay. If it is any cardiovascular diseases, then we'll use ethomidate. Fine. Whereas if it is a case of CNS asthma, will turn serious in a case of daycare surgery and LMA insertion. Okay, daycare surgery, LMA insertion and acute internal porphyria will use Propofol. Okay, Propofol. Okay, these are the IV agents you should remember and their indication. Okay, if you want to know about this inhalational part, you see this Halothane. It is used for asthma patient. Asthma will try Halothane. Fine. Whereas in a case of isoflurane, in a case of heart and daycare, we can prefer isoflurane more than desflurane. Okay, desflurane. Then heart and daycare. Okay, daycare surgery. Heart and daycare will use isoflurane more than desflurane. Then in a case of, if you see about this next one, which is sevoflurane, in the case of children, we use this sevoflurane. Okay, sevoflurane, and Halothane causes hepatitis. Okay, hepatitis. And for any cardiac, iso more than desflurane. Fine. And in the case of CNS, we will prefer using this isoflurane as well. Fine. Okay, or we can use in CNS. We can use more than desflurane. So mostly it is around the same for CNS as well, but CNS will prefer more of desflurane. Okay, so but this faculty is having this confusion still now. But for heart and daycare surgery, it is isoflurane more than desflurane nowadays because of the availability. Okay, the best is desflurane, but most commonly we'll use isoflurane. Okay. Next about this local anesthetics. If you see about this local anesthetics, like amino esters will be having one eye, amino amides will be having two eye. For example, procaine, cocaine, chlorprocaine and benzocaine. Okay, it is lignocaine and lidocaine. Okay, lidocaine, both of them will be having two eye. Okay, bupivacaine, lidocaine, prilocaine and dibucaine. So all of them, there is amino amides. Fine. And we'll see about few side effects. If you see about this benzocaine will be associated with this methemoglobinemia. It will be associated with this methemoglobinemia. Lignocaine, it can lead to the toxicity, and we know lignocaine can be used in a case of MI induced arrhythmias. Okay, in a case of MI induced arrhythmias, we can use lignocaine. Whereas this lignocaine toxicity can lead to this perioral numbness. It can lead to this perioral numbness, and there will be features of tremors and seizures as well. Fine. And it is contraindicated in a case of like hypertension, coronary artery disease. But lignocaine will mostly use for this infiltratory anesthesia. For any superficial procedures, infiltratory anesthesia will use lignocaine. Fine. And this lignocaine toxicity can lead to this perioral numbness. Itna yaad rakho. Fine. Next about bupivacaine. Bupi, it is the most cardiotoxic drugs. So with this bupivacaine can be used in a case of spinal anesthesia. But instead of spinal anesthesia, if you give in this intravascular access, it will be very toxic in nature. In such conditions, you need to give 20% intralipids to neutralize it. 20% intralipid solution. Fine. Remember. Okay. Then there is one more test which is known as dibucaine, which we use for this cholinesterase level by testing a test which is known as bupivacaine number test. Bupivacaine number test. They are dibucaine number test. It is known as dibucaine number test. Remember. And we have this cream which is asked in NEET PG 2024. NEET PG 24. It is known as EMLA cream. EMLA cream, it is the eucheric mixture of LA. Okay. Lignocaine and prilocaine. It is the eucheric mixture of lignocaine and prilocaine, okay, which is around 2.5 for, means both, like it will be having this 2.5% of this lignocaine and 2.5% of the procaine, and this is contraindicated in the case of newborns because it causes methemoglobinemia. So it is the ligno plus prilo, which is this equal mixture or equal mixture, which is 2.5%. Fine. And next, I told you it is IVRA. Okay, intravenous regional anesthesia. Okay, there is known as TIVA, which is total intravenous anesthesia, which is be used by this propofol. Whereas IVRA, it is regional. For example, you applied a tourniquet and you want to just use this region, so it is IVRA. So in such cases, you need to apply tourniquet here, and this tourniquet, in the case of upper limb, it should be more than 50 millimeter of HG plus systolic. So 50 plus systolic in the case of upper limb and 100 plus systolic in the case of lower limb. Okay, and most common used drug is 0.5% lignocaine, whereas bupivacaine is contraindicated in this case because it is a cardiotoxic one. Okay, cardiotoxic one, and it is also contraindicated in the case of sickle cell anemia or any vascular diseases like Raynaud's disease and peripheral vascular disease. Okay, itna yaad rakho. Fine. And about this muscular relaxant, just remember this muscular relaxant, there will be depolarizing and non-depolarizing, and non-depolarizing muscle relaxant, it will act with this competitive antagonism. And if you see, you need to know just this D-tuberculin, atracurium and cis atracurium. Okay, atracurium and cis atracurium, both of them, they will be metabolized by this Hoffman degradation. So if there is any kidney damage itself, or if there is any liver damage itself, we can give this drug, it will come out of it. Okay, itna yaad rakho. Fine. And whereas this vicuranium, it will be more cardiostable. The cardiostable one, it is the vicuranium. Okay, whereas the succinylcholine, it is the fastest acting and the shortest acting depolarizing one. Whereas in the case they are asking non-depolarizing, the shortest one is the mivacurium. Whereas this depolarizing one, it is what it is, the succinylcholine, it is the depolarizing muscle relaxant. Fine. And it can lead to this apnea, which is known as choline apnea, which is if there is deficient of the pseudocholine esterase enzyme, this can lead to this succinylcholine or choline apnea. So to test this amount of this pseudocholine esterase, then we'll use this number test, which is known as Dibukone number test, which we studied before, right? That is one. Fine. Next, one of the complication of this succinylcholine and most of this IVR means this inhalational agents, it is what it is, this malignant hyperthermia. This malignant hyperthermia, it is mainly triggered by this succinylcholine inhalational agents like halothane, isoflurane, desflurane, and ether and lignocaines. Fine. So mostly this will be having this continuous contractions in the muscles. So leading to this, there will be increased hypertension. Like this, yeah, most of the all inhalational will cause this malignant hyperthermia. So this will cause increase in temperature. To treat this, we'll use this dantrolene sodium. With the use of dantrolene sodium, we'll treat this malignant hyperthermia. Yaad rakho. And if you see, they asked about this layers of pyrosin. If you see, first we'll go through skin, then subcutaneous tissue, then see these three ligaments: supraspinatus, then interspinatus, followed by this ligamentum, flavum, and it will reach this epidural space. Okay, and finally this dura mater and arachnoid mater. If it is, they are giving this as a arachnoid. Yeah, there is, yeah, this supraspinous ligament, interspinous ligament, and ligamentum flavum, interspinous ligament. Okay, so remember the sequence. So if we are giving this epidural anesthesia, we'll stop here. But if you want to give this spinal anesthesia, we'll go till here. Okay, spinal anesthesia. Okay, so see. So if you see this spinal taper anesthesia, we'll go into the subarachnoid space. But if you want to, yeah, around the same for this epidural, means same for this lumbar puncture. Whereas for epidural, we'll just go till the ligaments and we'll stop before the dura. This is the dura, and before the dura, we'll stop and we'll administer the drug in the epidural space. Okay, in the epidural space. Itna yaad rakho. Fine. Yeah. And finally, the CPR. If you see about the CPR, the correct ratio for adults, it is 30:2, where means with one or two rescuers, like who or how many is there is no matter, but in adults it is 30:2. If it is pediatric case in children's, that is 30:2 if it is one people, if it is 15:2 if it is two rescuers are there. And unit, we always need one to hold and one to, because it is encircling techniques, right? So you will keep both hands here, then who will ventilate? So it will be usually two will be present and one will be ventilating. So see, so in such cases, there will be infants, it will be two people already present. So the ratio will be what? It will be always remain 3:1. 3 compressions and 1 breath. 3 compression and 1 breath. Okay? Next, what are the sequence? First you will check for the scene safety, then you will call for the help, and you will check for the response. Then you will check pulse, then breathing. Okay, then first you will ensure like whether is there any obstruction or something is there, then you will remove it. Okay, if breathing and pulse present, then what you will do, then you will put him in the recovery position. If breathing but pulse absent, then what you will do, you will give, no, if breathing is absent but pulse is present, then what you will do, you will give this rescuing breaths and monitor the pulse. Okay, if no breathing, no pulse, then if you need to start this CPR, which is at the rate of 30:2 in adults. Okay, 30:2 in adults. In pediatric cases, if it is one rescuer, it is 30:2. If it is two rescuer, it is 50:2. 15:2. Fine. And one of the modality they will ask you, what is the name, how you will do in a case of CPCR. One, you can give this chin lift. You can use your finger and you need to lift the chin so that you can open the airway, or else if there is any huge injury, then you can provide thrust to this area, which is known as jaw thrust. Okay, the final slide, it is the Mapleson circuit. So remember, see, Mapleson B and C, remember BC, it is Gali in Hindi, means like it is a bad word, so we won't use this BC. So we'll use Mapleson A, D, E and F. So what is the difference between Mapleson A and D is that this first graph flow, it is near to the patient in D, whereas Mapleson A, the first graph flow, it is distant to the patient. Okay, that's it. That is the only reason. Then Mapleson E, it is without balloon, and Mapleson F, it is on the way of E with a balloon. That's it. That's it. Okay, that's, if you know this truth, this they will able to crack, like which, if they ask you which type, you can able to answer it. Fine. Then Mapleson A, it is also known as Magel circuit. It is used for this spontaneous ventilation. It is used for the spontaneous ventilation in adults. Okay, whereas Mapleson D, it's also known as Bain circuit, which is used for this controlled ventilation in adults. Fine. This Mapleson E, it is also known as ISTPs, which is a bagless, means without any bag and without any valve. So it is used in, it is also used in a case of pediatric patients. Fine. Whereas Mapleson EF, it is used, it is also known as Jackson-Reeves modification. It is used for this pediatric patients for the spontaneous and controlled ventilations. Right? So these are the Mapleson circuits, and these are the images and most important things you should remember from this anesthesia perspective. Right? Remember one thing, like the final call is that you can do it, because you meant for it and you came for it and you are for it, so you can do it. So have this hope till your examinations, and you will come out with flying colors, and I'll be praying for you. Don't worry, I just keep your hope alive and keep your things going on. Okay, there will be many arts will be happening currently, but once you pass the examination, everything will be fine. Fine. It is really it is really very overwhelming that I took this 5-day session, and it was really like I enjoyed it the most, whether you enjoyed it or not, but I hope you also enjoyed the same, and you can use this as a revision material during your final point. And before giving your GTs, make sure you are reading these notes so that you will get the maximum output of it. Okay, maximum output of it. So if any, please ping me or reach me out, and I'm really thankful to this Dr. Bhanuprakash channel so for giving this opportunity to express it. I'm really thankful. And final way, it is you can do it, and I just want you guys to be come out of this flying colors and clear with really good marks. You have this patience, you have this consistency, because I have seen you guys for this last 5 days, you are consistent with your efforts and consistent in all scenarios. Be consistent for few more days, and you will come with flying colors. And if any, please reach me out in my Instagram. You can text me out, like you can text me at the rate of Sasidansi. You can text me out if any issues or things are there. And once you pass, please let me know, and please let me know, like once you are right within, once you complete your examination, please let me know how about the questions, how many questions has come up with it, so that we'll be conducting these sessions for this future generations with more immensely. Okay, thank you guys. If any, please let me know. Yeah, thank you.